Got it. Okay, now what would you say is a healthy response to give someone if they do seem to like show that they're trying to open up, but they're kind of, just like testing the waters, right? Like, what would you consider a healthy response if you are working with a person like that?
So you're talking about therapists, because I'm not exact. Are you referring to therapists working with people like that, or are you talking about friends or family members? What,
Hmm.
what's,
Pretty
what?
interesting. So, would it be different for both? Because I guess there might be some similarities, right? Like depending on who you're talking to, or is it actually going to be different based on who you're
Yeah,
working with?
yeah, it sure will.
Okay,
So like
you can,
when
yeah.
you're talking about people who have trauma histories, very often they have tried to share that with friends and family members, and friends and family members often don't know what to do with this information. They really don't. This trauma disclosures can actually tear apart a friendship. When people find out something about their friend that they never knew was real, and then all of a sudden there's this, looking at them in a way that they never looked at before. Some people will not respond very well to it, and some people do respond well. I mean, it depends on the kind of friend you have, depends on the family members. But these are people who are not trained. They're usually not, they don't know how to respond. And so you often get family members saying things like, trying to be positive, and coming from a good place. Of course, you have family members who blame the victim, and that's terrible when that happens. But
Yeah.
even if you have family members, let's say if somebody tells a family member that they were raped in university, they tell their older brother, let's say, or something like that, they were raped in university. Even if he's a good guy, even if he's trying hard, they're not trained, and so they might make all kinds of mistakes, such as, excessive positivity can be a very common mistake. Well, you're doing okay now. Don't worry about it. Try to turn a page. Try to be positive. Don't be negative about things in life. And it's coming from a good place, like they're trying to be helpful. But when a trauma survivor hears a family member become very positive about the person's trauma experience, like kind of like say, well, try to be positive about it. Listen, bad things happen to everybody. You'll get over this. I think you'll be fine. That kind of thing. That can be felt to a trauma survivor as a very minimizing response. It can be felt as though the person is, you know, shutting them down, doesn't want to hear about it. And very often they feel foolish, actually. So what might be intended as a positive kind of response from a family member trying to be caring and loving might actually really backfire. And again, these are individuals who aren't trained to deal with trauma. So what do therapists who are trauma informed know how to do?
Hmm.
They know how to really, or they're trained to really listen. They're trained not to make assumptions. They're trained to slow down. Somebody shares with someone who I've been working with, let's say for 2 or 3 months. Let's say they came in because of symptoms of depression or anxiety, and they've never shared with me anything about their trauma history. And after a couple months, they begin to trust me, and they start to open up and start to share something about their past. As a trauma informed therapist, what I want to do and what I would teach all my students to do is more than anything to listen, to slow down and listen, and to ask the person what the experience means to them. So let's say it's that same example I gave you of a young woman who was raped in university. And she, I have something to tell you, Dr. Muller. Actually, last year when I was in university, this is what happened. I would, I would slow down the whole thing and say, well, okay, tell me about it. And I wouldn't make assumptions. I wouldn't necessarily make assumptions that she's going to get over it. I don't know if she will. I wouldn't make assumptions that I wouldn't make any assumptions at all. I wouldn't even make assumptions about what she must be feeling. I wouldn't necessarily say, "Oh, you must be feeling devastated." I wouldn't say that either because I don't actually know what she's feeling. And that's another mistake sometimes people make. is they assume they go the other direction rather than being overly positive. They may be overly empathic. Oh, that's horrific. Oh, how terrible. And the client's, well, I didn't say it was horrific or terrible.
Yeah.
I mean, I'm feeling weird about it. I'm not sure what I feel about it. And they might have lots of complicated feelings, especially if someone was sexually assaulted by a boyfriend or a girlfriend. It can be complicated what they feel. They might feel angry at them, but they might feel guilty, and they might feel all kinds of things. We just don't know. We don't know what they're going to feel. And so a trauma-informed therapist slows the process down and responds with curiosity and compassion. Okay, so I'm hearing you say such and such happened. As you tell me that story, what do you find yourself feeling? And I don't know what they're feeling, but whatever that is, I'm curious about it and I'm listening, and I will follow their lead and I'll see where it goes. That's not an easy thing to do if you're a family member or you're a friend, right? I mean, you're not trained in trauma work, and of course people are going to try to be helpful in the best way they know how. And so I don't fault anybody if they respond however they respond. But it can be tricky for trauma survivors, because very often, while on one hand they know that they should be talking to a therapist, sometimes people aren't ready for that, and they find the whole idea of talking to a therapist very scary, and they want to tell their boyfriend, about what happened a year ago, or they want to tell their buddy, and it can be complicated.
Got it.
Yeah.
Yeah. So it seems like, obviously when you're working with someone who is trained, like yourself, the whole idea is to not put words in that person's mouth, right? Like, get them to truly figure out what they're feeling and let them put words to it without you just diving in and kind of telling them how to feel, right?
Exactly.
Yeah.